So internal fixation devices can be divided into intramedullary and extramedullary. Now it becomes much easier for you to identify the devices like internal and external fixation. And now it will become much easier for you to answer this question also. Like in the beginning, we have placed one question, a sample question is that open fractures are best managed by. Now, open reduction and internal fixation. Will you go for internal fixation in case of a extensive open fracture? Obviously not, because that internal fixation device is going to get infected. It will be having complications. All right. First, you have to manage the wound, make the limb healthy so that the bone will unite without any consequences. So open reduction, internal fixation is not the answer. Then closed reduction and internal fixation, actually when the question is not non-specific, they are just asking about the open fracture. So consider it to be a extensive kind of a open fracture where external fixation is something the examiner want to hear from you. So open reduction, external fixation, that is the correct answer. Closed reduction and external fixation. You see, when the wound is open, you are managing the wound. So you have to thoroughly debride the wound, you have to thoroughly clean the wound, and that could be achieved by opening the fracture site. So you reduce it by the open means and then perform external fixation. So the best possible answer for this particular question is open reduction, external fixation, because the fracture is already open. What will you do by performing closed reduction, internal fixation? All right. So you have to perform the open reduction, internal fixation in the management of the open fractures. So this is what we have already talked about as the internal fixation devices. Now something is known as prosthesis. You know, a prosthesis is a device which is replacing a part of the limb internally. All right. So internal prosthesis like hemiarthroplasty implants, this is an internal prosthetic device. Although when we are going to talk about this in case of lower limb trauma, we will be talking about the details of this internal prosthesis of the hip joint. But at this point of time, you just try to understand how the prosthesis looks like. All right. Orthosis and prosthesis. Orthosis is a support. Prosthesis is a replacement. And a prosthetic device could be internal or external. If a leg is amputated and you are providing a artificial limb, that is external prosthesis. In case the head is devastated, there is a fractured neck of femur, you have removed the entire head and neck and placed a prosthesis inside which is acting internally as a hip joint. So it will be called as internal prosthesis. So this is the basic introduction of the implants. All right. Internal fixation devices, external fixation devices, and the prosthesis. Now let's have a discussion of how open wounds are categorized or how open wounds are classified. Now just listen to this question, that a 5-year-old came to emergency with a fracture around the elbow joint with a brachial arterial bleed. Now open fracture is there associated with the brachial arterial bleed. How it will be categorized according to Gustello-Anderson. That means we are going to have a basic talk on open fracture classification, and that open fracture classification was given by Gustello-Anderson. So Gustello-Anderson gave the classification for open fractures. Now open fractures can be categorized into 1, 2 and 3. See, it is type 1, type 2 and type 3. But type 3 is further categorized into type 3A, type 3B and type 3C. Now what are the differences in between all these three types? I will quote one difference which is important for you to identify on the basis of which. Now you look at type 1. In type 1, the size of the wound in its maximum dimension is just less than 1 centimeter. The size of the wound in its maximum dimension is just less than 1 centimeter, and that is the highlight of type 1 injuries. That means it is just a puncture wound. Now, in case this is a size of the wound, then what do you expect? The soft tissue injuries will also be minimal. The periosteal injury will also be minimal. There will be least contamination at the fracture site because the fracture site is not directly exposed to the external environment. All right. So these are the findings in type 1. How you are going to identify a type 1 injury is based on the size of the wound. Now comes the type 2. Now type 2 is an intermediate in between type 3 and type 1. Now what happens in type 2? That there will be a moderate soft tissue damage, contamination or comminution, but the size of the wound obviously is going to be more than 1 centimeter. But it is of moderate variety. It's not like that the entire periosteum is lost, the bone is completely exposed to the external environment. There is too much of the soft tissue injuries. So it is an intermediate type of the injury in between type 3 and type 1. Now what happens in type 3? Type 3A is where everything is extensively damaged, but there is adequate soft tissue coverage to the bone. Now here what is happening? Extensive wound remains common here, here as well as here. Extensive wound. Wound is too much extensive, which has resulted in too much damage to the limb or the part of the limb. But the soft tissue damage is relatively considered to be of moderate type. Alright, moderate, or it could also be of extensive soft tissue damage. But what is more importantly appearing over here is the inadequate soft tissue coverage in case of type 3B injuries, while adequate soft tissue coverage in case of type 3A injury. Although it is not like that the examiner is going to ask directly about the type 3B or type 3A comparison, because more or less both of them appears to be the same, but the prognosis would be different because type 3B injuries are considered to be more extensive. There is more extensive damage to all the soft tissues surrounding the bone. What examiner is persistently asking from you are the questions from type 3C injuries. Now what is happening in type 3C, or how will you identify type 3C? Arterial damage. No other injury, open injury to the bone, according to Gustello-Anderson classification, is having an arterial damage except type 3C. So when there is an open fracture discussion with the arterial, major arterial injury to that particular limb, then answer for that question is type 3C injury according to Gustello-Anderson system of classification. One more thing which is considered to be a key potential question for this particular topic is that nerve injury is not a criteria, because in future they can ask this question that which of the following is not a criteria? Which of the following is not a criteria for classifying the bony injuries according to Gustello-Anderson system of classification? They will give you the mechanism of injury in the options. You know, greater the mechanism, higher the velocity of trauma, greater the chances of soft tissue damage. So that will be a criteria. They can give you periosteal cover, they can give you the comminution, they can give you the pattern of fracture, they can give you the arterial damage in the options. But if nerve is provided in the option, that will be the answer for that question, that nerve injury is not a criteria for classifying the bone injuries according to, or open injuries or open fractures according to Gustello-Anderson system of classification. Alright. So hopefully you have understood everything based on the pattern of mechanism of pattern of fractures, the devices which are used for the fixation of the bones, as well as the open injury classification. You know, periosteal stripping is something which is very, very important, and they have mentioned about the periosteum that if the periosteum is removed from the bone at the time of impact, it will be having poorer union outcomes. But if the periosteum is intact, it will be having better outcomes, because periosteum is also responsible for formation of the bone. That you will come to know after some duration of time. At this point of time, you just try to understand that open injuries to the bone is not only involving the pattern of the fracture, is also involving the soft tissues, is involving the contamination, is involving the periosteum, and is also involving the possible arterial damage. Alright? And this is how you are going to distinguish in all the three different types. Next topic is growth plate. Now, all of you are very much aware of what the growth plate is. Like, it is responsible for increasing the length of the bone. Now, if you look at the two different kinds of the bones, like one is skeletally immature and the other one where the growth plate is obliterated, that means it is fused already. So how does it look like? You see, if you divide an immature bone into different components like this one, this is the epiphysis, and here we are having the metaphysis, and in between the two, the line which is visible is the growth plate. So this is the growth plate. This growth plate is also known by the name of physis, and it is also known by the name of physial plate. Alright, so growth plate, physial plate, or the physis is one and the same thing, and it is present in between the epiphysis and metaphysis of a growing bone. Now, In case of a mature bone, this growth plate gets obliterated, as a result of which the epiphysis will come in continuity with the metaphysis. So there is no such distinction in between the two. Now, if you look at these growth plates in any articulating bone, so there will be a proximal growth plate as well as a distal growth plate, which is articulating with the distal epiphysis. All right. So that is the essence of identification of a growth plate. If growth plate is visible in any bone, that means it is still growing. But once the growth plate is not visible in any bone, that means the growth is completed and the growth plate is fused now. Now, as far as growth plate is concerned, the major function of the growth plate is increase in the length of the bone. All right. It is responsible for increasing the length of the bone. It is not responsible for increasing the width of the bone. The width of the bone is the function of the inner layer of the periosteum. That means cambium layer of the periosteum. Okay. Now, one growth plate is actually divided into multiple zones. So there are additional zones in the growth plate. How? For example, if you see, this is the epiphysis, this is metaphysis and diaphysis, and in between we are having a growth plate. Now, this growth plate is further divided into multiple zones, and these zones are given in the form of a question. Now, imagine if we talk about this question in particular, that which of the following is the correct sequential order of the growth plate. This is the sample question which is provided to you. So, what is the order in which these are arranged? Like, there will be the germinal zone, then the proliferative zone, then there will be a zone of maturation, then the hypertrophic zone, and finally the zone of provisional calcification. All right. So this is how these different zones of the growth plate are aligned. So the germinal zone is present at the epiphyseal end. You know, the growth plate is present in between the epiphysis and metaphysis. So germinal is actually the epiphyseal end of the growth plate, while this zone of provisional calcification is actually the metaphyseal end of the growth plate. So it is nearest to the metaphysis. And this is what is being provided to you in this sample question that we have given. A question is that which of the following is the correct sequential order of the growth plate zones when we move towards metaphysis. All right. So if we look at the first option, that is proliferative, then after that there is zone of maturation, then there is zone of hypertrophy, and finally the provisional calcification, and this is considered to be the correct answer. In next of the other options, we have just rearranged the sequence, which is all incorrect. So that is the correct answer for that particular question, because in future they can ask you that what is the arrangement of these growth plate zones which are moving from epiphysis or towards metaphysis, or from metaphysis towards epiphysis. So this sequential arrangement also is something that you should be aware of. So by this time, what we came to know is that growth plate is responsible for identification of immature bone. Growth plate is present in between epiphysis and metaphysis, and growth plate is further categorized into different zones. Now, what is the orthopedic significance of this growth plate? Just try to understand. Imagine if there is a fracture in this skeletally mature bone over here in the epiphysio-metaphyseal region, then the prognosis of this fracture would be based on union only. But if there is a fracture which is involving a epiphysio-metaphyseal region in case of a child, then the growth of the bone can also be hampered. So it might lead to affect, or it might affect the growth. That means increasing the length of the bone could be affected. That is the reason why the fractures or injury to the growth plate is considered to be a separate topic, and the name of the topic is the Salter-Harris classification. So Salter-Harris is responsible, or this classification is responsible for ramifying the growth plate injuries. All right. So Salter-Harris primarily has classified the fractures into 5 different types.